Hello everybody, my name is Dr. Darren Saks with Tenafly Pediatrics, and I'm going to be talking to you guys about nosebleeds. What I want to talk about is why nosebleeds happen, when you need to worry about nosebleeds, and if a nosebleed sometimes is signifying something else. People tend to get worried about nosebleeds because anytime there's blood, people kind of panic. But let's first talk about why the nose in particular is a bloody area. Versus your ear or your toe or whatever. The front of your nose, right in this area, there's a collection of blood flow that is very prominent, and it's called Kesselbach's plexus. And if you look at this little diagram that we have, you can see right in the front of the nose area there's this overlap of different blood vessels that come together, and what that does is it creates an environment that's very susceptible to simple bleeding. It can happen for no reason. It tends to happen more when the nose, which is something we breathe through, is drier. So we all realize that nosebleeds happen much more often in the fall and the winter, and they tend to happen much more at night when you're breathing through your nose, you're not lubricating the area as you typically might during the day. So we all know that it happens a lot more in the winter, with fall and winter. But another reason it happens is during times where your nose is inflamed. So we're going to see a lot more nosebleeds when kids get colds, when allergy season arises in the spring or the fall, or obviously when there's trauma. And we don't just mean getting punched by your brother, we mean picking your nose. That's a very common type of trauma. And one of the things I learned long ago as a resident is when a kid comes in with a lot of nosebleeds, first question you ask is, which finger do you pick your nose with? But in all kidding aside, nosebleeds are very common. So the first reassuring thing is don't worry about it. And now the most obvious question is, well, what do I do when I get a nosebleed? Well, you want to apply pressure. Anytime you have something bleeding, the best way to stop the bleeding is to compress it. Some people don't compress it in the right area. If we're talking about the front of the nose, that's really where you want to compress it. Some people try to hold higher up, which isn't going to do very much. So you want to really hold where the hard and the soft part of the nose meet. Here's my soft nose, here's my hard nose. So you want to squeeze here. The biggest mistake you can make when you're trying to compress a nose is to not hold long enough. The general idea is to hold for 5 minutes without stopping. A lot of people do this, and they keep letting go just to see if it's still bleeding. And that's a no-no. Hey, that was a good pun. That's a no-no. So you want to hold for 5 minutes. Look at a watch, or if you're the one holding it for your kid. And if you do have access to some kind of cold or ice, that's also helpful because anytime you put something cold on a blood vessel, it constricts. So a compression with something cold is the best way to stop a nosebleed. And the first, or the most important thing, is the duration. You really want to hold for a good 5 minutes. After that, you're going to generate a good clot. And another mistake that people sometimes make is that they want to lean back and they go like this. And the reason that's not a great idea is because anytime you lean back, you're going to have that blood that's flowing and starting to clot kind of drip into the back of the throat, drip down into the stomach, which is nauseating, can cause some vomiting and a feeling of discomfort. So you want to lean forward, and you want to hold firmly, leaning forward, and trying again 5 good, even up to 10 minutes if you have that kind of patient child. All right, so that's enough about what to do. I think that's going to give you some good quick advice. Now the question is, when should you worry, or when do you need to kind of take it to another level? Well, if your child gets a lot of nosebleeds, a couple of simple things you want to keep track of. Is it always the same side? So is he always bleeding from his right nostril versus his left nostril? Then you're more likely to have a blood vessel that is very susceptible to bleeding, and a step that we would consider would be going to a specialist to cauterize it, which is basically just trying to sizzle or fry that blood vessel so it's not so susceptible to bleeding. So if it's always from the same side, that's one big thing to monitor for. Another one is if the bleeding is truly very excessive. So you did all the right stuff, you held for 5 minutes, but yet it's still very prolonged bleeding, where you're having to repeatedly hold in the area, more than 1 or 2 nosebleeds a week. That's something that we'd really consider, referring to a specialist. And those are two of the main things, I guess, that's worth mentioning. How do you prevent a nosebleed if you're prone to them, if you don't necessarily need a specialist? We generally recommend putting some Vaseline just in the front of the nasal area, just to lubricate it, to keep any scabs that might have formed from a previous nosebleed from cracking too much. And you could also try to keep your room at night a little bit more humid. If you have a dry house, or if you feel like it's a winter time where it's generally drier, using a humidifier is reasonable. And then the last thing is worth mentioning is, when does a nosebleed represent more than just a nosebleed? The things to monitor for, or the things to consider, is if there's other areas that are prone to bleeding that wouldn't be typical. So a child who brushes their gums and they bleed, along with getting frequent nosebleeds, or a child who doesn't have just the typical bruises on their shins, or a couple of places on their body, but they really have big welts all over their body, or they react pretty poorly to just simple trauma. Or, most importantly, there's a strong family history of someone with certain bleeding conditions like von Willebrand's disease, or of course hemophilia, which these are things you would probably know about prior to your child getting a bleed. So those are just some quick points about nosebleeds. Hopefully you guys all found it helpful, and I will say goodbye.